Good afternoon, everyone, and thank you for joining us this afternoon for this press briefing on Delaware's response to the COVID-19 situation here in the state of Delaware. I'm joined on the auditorium stage here with Dr. Karyl Rattay, who's our Director of Public Health for the state of Delaware, doing a fantastic job leading our team of public health workers at the State Health Operations Center in Smyrna, just doing incredible work. And to my left, you're right, A.J. Schall, who's the Director of the Delaware Emergency Management Agency, and he's our point person on our response to the COVID-19 situation here in Delaware. Before I make some opening remarks and open it up to questions from the media, I'd just like to make a few thank yous, to offer a few thank yous and remarks on behalf of so many people across our state who are just really coming together as we respond to this really unprecedented situation, a situation that none of us have seen before in our lifetimes. Probably the closest thing to what we have with this COVID-19 pandemic is the flu pandemic dating back to 1918, and we weren't here then. It ravaged our state and the country, and we're seeing the kind of situation here with COVID-19. Healthcare workers across our state are just doing an incredible job working on the front lines. Our hospital partners have been amazing. We talk to them on a regular basis each week. The first responders, EMTs, paramedics, ambulance personnel, our law enforcement officers across the state. Our Secretary Walker and her team at the Department of Health and Social Services, social workers reaching out, our Lieutenant Governor and others reaching out to the homeless to make sure that they're safe and have the needs met that they have. I mentioned the Division of Public Health staff. And lastly, frankly, to the media, which has been very creative in helping us get important messaging, including what we're going to talk about today in this press briefing, out to the people of our state. If I think about the challenges that we face, the most important thing is to reduce and prevent the spread of the COVID-19 virus here on the front end, so that we have the hospital capacity as we move through this situation to treat and provide emergency care to those who are sickened by the virus, who overwhelmingly have been our senior citizens here in our state, and we reach out to them on a regular basis to provide protections for those. And to the families and friends of those who've passed away from COVID-19, our thoughts and prayers are with you. All our efforts are geared towards saving lives in the long term, and I want to thank the media for helping us get the message out creatively. That's both TV, print, and radio. Big Ivan at DETV has been doing a wonderful job helping us to get our message out with virtual question and answer periods and town hall meetings, which Secretary Walker, Director Rattay have done, Director Schall have done as well. And so we thank everybody for that. The situation in Delaware is getting worse, and we expected it to. The number of positive cases that you see on this chart has risen to nearly 400 as of yesterday. The current numbers that haven't been made public today are well over 400, and the number that we look at most is the hospitalization number. Because when you get right down to it, when you talk about providing critical care hospital services to those who need it, the number of people among the positive cases that need hospitalization and critical care in particular gets to be the number that we track and look at. And that number is going to be significantly higher than the 56 hospitalizations that you see on your chart, which was yesterday's number. Because that number is a number that we report to the Centers for Disease Control, and it only includes Delawareans, and we have people from other states who are a part of the service area of Christiana Care and our other hospitals in the lower part of our state. And so that number today is close to 100. And so we are expecting, we have a group of scientists and epidemiologists that are working on a function, a graph that would predict when to expect hospitalization surge coming, and we expect that over the next 2 weeks that we'll see a surge in the number of positive cases and the surge in the need for hospitalizations, and all our efforts and all our messaging to have every Delawarean follow the executive orders and in the amendments that I've made as part of this state of emergency, which you can see on this chart dating back nearly a month to March 11th, which is when we had our first confirmed positive case of COVID-19. The next day, on the 12th, I issued the first state of emergency declaration. We closed schools for 2 weeks on the 13th with the expectation initially that they would do planning to provide remote instruction for the children for some extended period of time to figure out ways that they could feed the children that we feed every day, thousands of children the districts in our state feed, and they've done a tremendous job in standing up their summer feeding programs, which are safer, which protect both the school district employees as well as the parents and children from the spread of the disease. Really, as a result of what we saw on the ground and too many people crowding into bars and restaurants, we ordered those establishments closed on March the 16th. Based on what we saw on one of the nicest spring days this year, we had to close the beaches on March the 21st. And then on March the 22nd, we ordered a stay-at-home order for all Delawareans, again, with the purpose of protecting everyone. And our message all along has been that your actions affect your neighbor, and your neighbor's actions affect you. And our primary objective is to, if you've heard the scientists on the television talk about all the time, to flatten the curve. That means to reduce the spread of the virus here in our state, to protect everybody, but particularly to protect our most vulnerable populations, our elderly parents, grandparents, aunts and uncles, and friends. And so we closed the schools until the middle of May on March the 23rd, and then on the 29th, mostly because we were seeing a lot of people traveling to Delaware for various reasons, including because maybe some of the services were not available or were closed down in Pennsylvania or Maryland in particular. We ordered that out-of-state travelers needed to self-quarantine for 14 days if they traveled to Delaware, which obviously discourages people from doing that. And they can travel to Delaware to work in an essential business, to provide for an elderly parent or family member. And so we are working through different ways to enforce that provision, because we continue to see in various parts of our state people traveling across the border in a way that's not permitted by our state of emergency. On April the 1st, we also ordered additional restrictions, limited gatherings to 10 people or fewer, and required those businesses and establishments that were open to have certain social distancing requirements and demarcations in their grocery stores, in the big box stores, to make sure that the customers coming into those stores were following the rules. And we will continue to look at ways to enforce those rules to keep everybody safe as well. And then yesterday, a call to action for every Delawarean to help us with supplies and material that are in great demand in our state. I look forward to answering any questions. And again, I want to thank all of our partners, the hospitals, healthcare providers, the media, all our educators, and those who are working remotely from home, keeping our state government open, those who are required to go to work every day, our first responders and those who work in our prisons and juvenile detention centers, and of course the team at the Delaware Emergency Management Agency and our Division of Public Health. Thank you for the great work that you're doing. Our message is simple, and it's to every Delawarean to stay safe, to stay home. All the restrictions that we put in place by all these executive orders and the amendments have been to protect the health and welfare of all Delawareans. And so with that, I'm going to turn it over to AJ, who has a few comments to make as well.
Thank you, Governor. So while we are about a month into since the first positive case in Delaware, partners from around the state have been coordinating since mid-January. So that is partners from the local, county, and state partners, which we have had a great, coordination with, and we look to continue that as we go forward. There's a few areas that we're really providing focus right now. For the first few weeks, it was really the continuity of government and operations for our departments across the state to make sure we were able to contain a level of service to our citizens as much as possible without disrupting them. We're monitoring and assisting in the supply chain integrity. So this is everything from providing waivers to grocery store chains and essential businesses that have to stay open, to what we could do to assist the Division of Public Health and other public safety partners to get the proper personal protective equipment they need. We're looking at the community support and recovery coordination. We know that this is going to be a long-term event for a lot of individuals in Delaware. We saw some very high unemployment rate or claims numbers from the first week after some of these actions took place, and we are doing everything to make sure that the social services, whether it's from the state partners or nonprofits across the state, are able to support the survivors and those impacted across the state. Medical surge and capacity, which we'll talk about a little bit more in the next slide, but also alternate sheltering capability, where we're able to take high-risk individuals that may have been exposed or be test positive and move them away from a shelter or another type of area into someplace safe where they're not going to be getting other people infected. Last night, the governor did sign off on a major declaration request that went up to the FEMA office and to the president for review. This would allow us to pull in additional individual assistance programs into the state if this gets approved, which we're hoping will be done in a short order. This would be additional disaster unemployment, child care, medical coverage, other things that really help those that I already mentioned are affected. We've had some great partnerships blossom because of this with our healthcare industries. Nemours and Christiana Care have really taken the lead in assisting us with an alternate care site up here in northern Delaware. We're working with Nanacoke, BB, and Bay Health to work on a few options for the southern hospitals to make sure they have the services, staffing, and individuals needed as we prepare for the surge in the hospital, the numbers going to the hospitals. Bloom Energy, we hear a lot of people talking about the need for ventilators. Luckily, we do not need them yet, but we are preparing. We have procured some on the open market. We also received a introduction between Senator Coons and Bloom Energy about 2 weeks ago to see if they could retrofit and refurbish ventilators that we had at the state for about a decade or so, and I'm happy to say they returned about 35 of those yesterday, and we're expecting about another 60 to be refurbished in the next few days, and they will be on the shelves waiting to distribute as needed. And we also introduced Bloom Energy into the New Jersey Office of Emergency Management to see if they could help with that as well. We've heard about the hand sanitizers that some of the local establishments are making. It's the creativity and the spirit of Delaware and America, like we've seen in the last few weeks, that's going to help us on the long haul. And with that, I'll talk a little bit about the hospital systems. As I mentioned, we're working with them day to day to identify and try and model and see where we're going to go. Some projections that we've seen right now are pretty on point. We're seeing about anywhere from 15 to 20% growth a day in cases. Some days are lower, some days are higher. Dr. Rattay talked to about some of that's the result of the reporting that comes back. But we know in the next 10 to 14 days, we are going to see a spike. And that spike of positive cases is also going to mean an increase into the hospitals, an increase into intensive care, the need for ventilators. And so we are coordinating multiple levels to make sure we prepare for that. The protective actions as the governor has already enacted are hopefully going to make that a more manageable rate of increase. We still know people are going to get sick and they're going to be positive and they're going to be hospital, but if we could keep that to a manageable level, we keep the stress off the hospitals, and that's going to be what helps us get the best services to our citizens. So with that, I believe I'm going to turn over to Dr. Rattay.
So before Dr. Rattay, I'd just like to comment on this graph here, and it does, I think, a very good job for all of us of illustrating the surge in the number of cases. And everyone needs to remember that the number of positive cases is in part a function of the testing that we've been able to do. We haven't been able to do the comprehensive testing that maybe we would have liked to have done because we only had a limited supply of the testing kits. But that top graph that starts to spike up over the next several days is the number of positive cases, and then importantly, the number that we keep track of is the bottom graph, which is the hospitalization and the hospitalization rate that goes along with that the increase in the number of cases. One of the functions of that is our ability to protect our senior citizens, is because they're most likely to need hospital services, and so we have stepped up our efforts to do just that. We've seen some spread into some of the nursing home facilities and have experienced some deaths as a result of that. But our numbers are actually tracking right now pretty well with this graph. We're a little bit below it, and we want to stay below it all the way through. But this is the kind of thing that is informing the decision-making that's underway and the actions that we're taking. So with that, Dr. Rattay.
Great, thank you, Governor. So our data are showing significant increases already. If you compare us to where we were about a week ago, it's about a quadrupling of cases. And although this is not unexpected, it certainly does demonstrate that we are seeing community spread throughout our state. We've known all along from watching what happened in China that it is our older populations and those with chronic underlying conditions for whom we are most concerned. Those are our most vulnerable populations for COVID. However, when we look at our data, we do see that our highest numbers are among those between the ages of 18 to 49. So although many of those individuals have the more mild or moderate illness, certainly we're seeing spread throughout the ages. But no matter the age, anyone who has heart disease, diabetes, lung disease, severe obesity, or who is immunocompromised are considered high-risk populations and are at higher risk for consequences. So as the governor mentioned, we are very concerned about spread of infection in long-term care facilities. We already have seen spread in a number of our long-term care facilities, and sadly, half of our deaths are associated with long-term care facilities. And the Division of Public Health and our sister agency, the Division of Healthcare Quality, are working very, very closely with long-term care facilities. We have had a team out to every one of these facilities over this week to work with them to ensure that they are screening all individuals who come into their facilities, or really limiting the individuals who come into their facilities, but certainly screening healthcare providers, and also really maximizing infection control throughout their facilities. And also, very importantly, that they know how to identify whether someone may become symptomatic so we can get on top of an outbreak as early as possible. So these efforts in partnership with our long-term care facilities is going to continue to be incredibly important. We have learned a lot from our epidemiologists and from the testing that has taken place and from the cases that we see. One thing that we have seen is that many individuals who have symptoms are going to work or are going out into the community. And this is why this has become so important for our messaging and really for our policy approaches this week. We're now requiring screening for anyone who goes into a high-risk essential business, like any kind of healthcare facility or congregate setting. It's critically important that any individual who goes in those facilities is screened on a daily basis. The other thing that's been important from our data is we are looking at the symptoms, and we've been talking all along about fever and cough and shortness of breath as important symptoms, but from our data and from data studies that have taken place otherwise, what we've seen is that people develop symptoms in the couple of days before, mild symptoms, before they really begin to feel sick. And so we're asking anybody, if you are fatigued, if you have body aches, if you have stomach pains, if you have a loss of appetite, diarrhea, those kinds of symptoms are also key indicators that this may be coming on and you need to stay at home. And as the governor said, everyone needs to stay at home, but especially those individuals, including those who are working in essential businesses, need to stay home, and we're really pleading with people. Two more things I want to touch on. One is around community testing. We are so grateful to our hospitals across the state who have all been doing community testing. Over 8,000 tests now have been completed or specimen have been collected across the state in these community testing sites. In addition, at our public health lab, some of our higher priority individuals where we can get a quicker turnaround, we have tested over 1,300 individuals. So although testing is not where we want it to be, we are eagerly awaiting additional supplies, both the hospitals and at public health, to do more testing. This testing has enabled us to have a better understanding of what is going on in our state. And finally, I just want to touch on the upcoming holidays. We're about to enter Holy Week, Passover, Ramadan, and we know that this is an important time for many, many people across our state to come together, whether it's religious celebrations or family gatherings. And we are imploring everyone, faith-based leaders and families, to begin to think now about how you're going to do this differently this year. Many faith-based leaders have stepped up and are creatively looking at different ways to do virtual religious celebrations, and additionally, many families are starting to think about virtual dinners. But we really want to implore people not to come together with anyone other than your immediate family, and please, if it's not your immediate family, do not celebrate with those at higher risk. And with that, I will turn it back to the governor.
Well, thank you, Dr. Rattay, and again, a special thanks to you and to your team and to all those at the Department of Health and Social Services for the really fantastic work that you're doing in conjunction with our partners in the hospitals and the first responder community here in the state of Delaware. So our message is really pretty simple, and that is that we're all in this together. We can get through it if everybody follows the rules, the guidance that we've made available, and follows the orders that I've issued through the state of emergency declaration. Stay at home, practice basic hygiene, protect your neighbors, particularly look after your elderly parents and grandparents and friends. I check in with my 89-year-old mother. I probably shouldn't have mentioned her name, but her age as often as I can, and so do my 8 siblings. If we do all these things, then we'll be able to save lives. And this you see up here on the screen, the website de.gov/coronavirus really has got tremendous information for everybody and updates. And we've had 1.7 million views over the last 30 days, which is an incredible amount, which speaks to the seriousness of the situation, which speaks to the need that people across our state have for information, which is why we're here today for this press briefing. And so I want to thank my colleagues on my right and left and open it to questions of the media here in the room And then I think we've taken some questions online, and we'll answer those questions. So any questions from the media in the room? Yes, Tim.
Governor Carney, we heard about a party busted at University of Delaware the other day. State police this morning are shooing people away from Total Wine. Overall, how would you say, not to make you sound like the parent of Delaware, but how would you say the kids are doing? Is everybody behaving like they're supposed to? Are you satisfied with the response you've gotten? Or is it something that we're still seeing too many issues?
Well, to extend your analogy a little bit, I grew up in a large family with 8 siblings, and it was always a little bit difficult for my mom and dad to get the message across and for everybody to follow through. Sometimes you have to have enforcement measures. We don't need to get into that in terms of what mom and dad did, but we're seeing that, and some of the action that we've taken was because people weren't observing the rules. They weren't paying attention to the need for social distancing. They were going out in groups larger than they should have been, and so we've closed down some of those activities. We've tightened it up to groups of 10 or fewer. We've made clear on what our expectations are for essential businesses that are still open, grocery stores, the big box stores, Wawa. Now, having said that, I see lots of people following the rules, probably more people following the rules than not, and that's kind of always the case. And I see businesses that are really doing a tremendous job of marking out 6-foot areas in their stores and making sure that only so many people are in the building, as we are now requiring as a percentage of their state fire capacity. And so, yeah, I think we're going to have to remind people about the rules. We're going to have to show that we're serious about travelers coming in our state for non-essential activities. And continue to reinforce. And as the situation, as we move up on that graph with more people catching the virus, unfortunately with more deaths, then that'll have the effect of getting people's attention as well, and having press conferences like this and briefings where we're showing people the numbers that we're basing our decisions on, we might get better compliance. But I think overall, I've been really pleased with the way Delawareans have come together. And I know that the only way that we're going to get through this is if we all come together and follow the rules. Please.
Yes, CBS 3. Earlier today, I was up in Claymont for the Wine Spirits effort. And what I noticed and what my reporter noticed and asked if I would address this with you, what we saw were officers not maintaining social distancing and going right up to vehicles. In many cases, passengers were right up against them. In some cases, drivers were a foot away from them, and they were not wearing any protective gear. Why would they put themselves and possibly others at risk like that at this time?
Obviously, we'll check into that situation. They've been given very strict guidance about how to approach a car from the passenger side for just the reason that you're saying. And they're going to do that. Yesterday, they were up there doing kind of a reconnaissance walkthrough to see how it would operate, making sure that they weren't creating a traffic hazard out on the interstate or on Naaman's Road there. And so this is something that they'll work through and get it right as we get further along into it.
There are healthcare workers here in Delaware that feel like they don't have enough PPE to safely do their jobs, and they feel like the hospitals aren't adequately distributing it to do their jobs safely. What do you say to these workers, but also what role does the state have in determining how the hospitals distribute the PPE that comes in?
So the hospitals themselves handle the distribution of the PPE. They do most of the ordering themselves. They have their own supplies. We have supplies that I'll ask Dr. Rattay to talk about. We coordinate with the hospitals almost every other day to check on our supplies, and everybody's kind of following the CDC guidance on the use of that equipment. My understanding is that they're very vigilant about the use of it, and we're always looking for more supplies, whether it's masks, whether it's the shields, the gowns, the gloves. And I have every confidence that the hospital leaders are managing that appropriately based on the meetings we have. Do we need, and will we continue to need, more protective equipment? Yes. Will that advice that we're getting from CDC, in particular about the use of masks, we'll see. What I've heard recently is they're encouraging people to use masks, not so that you won't catch it from someone else, but if you have the virus yourself, you won't transmit it to somebody else. We're trying to follow the science. In some ways, it's evolving, and the guidance that we get from the experts.
Yeah, Meredith, it is a really good question. So probably 5-6 weeks ago, we went into a mode of conservation for PPE, anticipating that curve that you saw. And the conservation approaches, which is on CDC website and on our website as well, are supported by the science as safe. However, it is uncomfortable for some healthcare providers who are used to, throwing lots of PPE away on a regular basis, because these approaches are really teaching healthcare providers, showing healthcare providers how you can reuse certain pieces of PPE. And for many, it's just not what they're used to. But right now, we don't have a shortage. We're keeping certainly a close eye on some items that are more difficult to get, and really preparing for when that curve goes up to make sure that we really do have the PPE to keep everyone safe.
And you mentioned a surge of cases in the next 2 weeks. Is there an idea of when the peak might come? Is any data showing when cases will start to decline?
We have a very high-level group of folks that are looking at our data, and they're using the projections that we've received from FEMA and factoring in the data that we have on the ground, which has different nuances in it. And one of the things that we all need to keep in mind is that our data is several days behind anyway, right, other than the hospitalization number. We know who's in the hospital. But some of these tests take a long time to get back. Some, we can turn it around in 24 hours at the state, the public health testing lab. Others in the commercial labs could take days. And so the number of positive cases tends to lag behind. But we're following and making our decisions on the hospitalization rate. AJ, we do have a team of scientists working and calibrating our model and trying to fine-tune it based on what we see on the ground.
So the only other thing I'd add is it's kind of like a weather forecast. We know it's the data, we're looking kind of that 7 to 14 days out. We know if we go much farther after that, there's going to be a lot of questions on how well has the governor's orders of social distancing or shutting down restaurants, what's the long-term impact of that? So I would say 14 days out, we're pretty confident we're going to see a increase. What we're hoping is it slows down a little bit, and then it kind of gets run. It's going to be run every few days to make sure we keep our eyes on it and make sure the decisions we make outside of what's essential and non-essential, but also that plays a big role into how we coordinate with the hospital system and the EMS workers and paramedics and all that.
What we do know is the slope of that graph depends on our ability to enforce the restrictions around movement and social gathering and social distancing. If we can flatten that curve, if you can envision that in your head with respect to that graph. If we can't, it's going to go up. You can see the graph there. All of our efforts are to flatten that out by minimizing the spread of the disease, by keeping people from contacting it with contact to people who are positive and contagious. In the back.
Yes, Dr. Dennis, CBS Philly. What's your takeaway with governors still state to state making the call on how they are, what measures they're going to take or not take, versus a uniform protocol for all states to act basically the same, on the same page?
Yeah, so the question is, what is my take on kind of a more global approach to managing the situation as opposed to governors doing it on the ground? It seems to me that there's room for a mix, right? Our emergency management strategy is based on local execution, state management, and federal support. Local execution, that's the cities and towns and counties. State management, that's us and the governors. A federal support, that's FEMA, the CDC, NIH, the White House Task Force. And their focus is to support all our efforts on the ground. The situation is very different in each of the states. What I tend to do here in our management of the situation in Delaware is keep in contact with Governor Wolf in Pennsylvania, Governor Hogan in Maryland, and Governor Murphy over the river and bay in New Jersey, and see what's happening, what they're doing there. We have kind of coordinated the emergency amendments as time has gone by. But the situation's very different. And when you're managing from the federal level, your priority goes to the states that are the hardest hit. New Jersey, New York, California, Florida. That did not include Delaware in that. And so we need to make sure we can take care of our own needs here in our state as some of these scarce resources are being diverted to places like New York, where the situation is much more serious. So there's room for both federal and national and regional efforts and management, as well as state-based management. Are there questions?
Times. Yesterday, we had federal data that showed about another 19,000 unemployment claims in the state. We've got almost 30,000 to date through the crisis. I just wonder if you could shed a little light on how your administration came up with its essential business list, how you feel you've been able to do with that to date, whether any further changes may be needed, and how the appeal process has been going.
So you got a lot packed into there. It's first of all, the folks that have really been hit the hardest, other than those who've suffered through the virus and the illness, and obviously the families of there, and particularly those who have died, the people who are bearing the biggest burden are small business owners who had to shut down. Your bars, your restaurants, any non-essential business that's not able to stay open. Your employees, your workers who have gone on unemployment as a result of that. You mentioned we're up to 19,000 or so that have filed unemployment claims. In 3 days, they broke the former monthly record of just shy of 10,000 by seeing 11,000. And so the stimulus package that thank God, was passed by Democrats and Republicans in Washington, D.C., with support from our congressional delegation, is really important for those small business owners and for those workers, both in terms of enhancements to unemployment, some changes to the rules around that, as well as supports for small businesses to get us over this shutdown and to provide a bridge to when we are able to get the economy moving again. Really, really critical. In terms of essential businesses, some of it is just common sense. I mean, we tried to keep businesses that people need in order to survive. Food, medicine, home supplies, you name it. You know, people have asked me, why do you keep liquor stores open? Well, the health care provider said if you close liquor stores, you have people who are alcohol dependent who will go through withdrawal and end up in my emergency room, and we don't want to have that. So there's a rationale behind all of that. Most of it fundamentally is around what is essential to keeping people alive and able to live alone in their homes and not going out except to buy those essentials, and then certain things that can be done in a way that's safe, or both the essential business is done in a way that's safe. So that we've had thousands of appeals come through, as you can imagine. It's been a very difficult exercise for our Division of Small Business. But Damian DeStefano and Secretary Bullock and their teams have done an extraordinary job sifting through that and trying to make those very difficult decisions. Tim.
The next question comes from Jose Somalo at Oyen, Delaware newspaper. Is Delaware going to be able to perform quick coronavirus tests, which may help to understand the real extent of the crisis? They believe that with the lack of proper testing in the Hispanic community, the virus will be undetected for some time in Delaware's kitchens, production facilities, construction sites.
So one of the things one of the positive things coming out of our meetings with the hospitals, Dr. Rattay mentioned that the hospitals are really the ones that are providing the community testing in their 7 sites across the state, Newcastle County, Kent County, and Sussex County. And so they use their own resources for doing that. Some of those are through commercial labs. And the turnaround time for a test at a commercial lab has been quite a few days, more than a week recently. Our turnaround time for the public health lab, and those tests are, and I'll let Dr. Rattay comment on this, those tests are kind of reserved for people who are sick and ill and first responders, so we know that we can, healthcare providers, so that we can get those people back in line. But we are optimistic. There's been some breakthroughs in terms of the equipment used by Christiana Care and hopefully by some of the hospitals downstate, that they'll be able to do the testing in-house and turn them around on a more timely basis.
Yes, I mean, our testing access has increased slowly. The hospitals have been amazing partners in this. As far as rapid tests, we do have some rapid tests that we hope are going to make it into Delaware in the next 24, 48 hours, if the FDA will release them, hopefully soon. Those will enable us to get quick testing done, for example, if we're concerned about an outbreak in a long-term care facility, or to be able to test individuals, to triage them as they arrive at an emergency department, or healthcare workers to help them get back to work. So those are going to have an important role as a part of the overall testing strategy. But we're all looking forward to the time when these supplies are more accessible, more predictable, and our testing is quicker.
We did have a positive meeting the other day on testing, in which each of the hospitals indicated that they had at least a number of tests, given their current utilization rate, to take us 2 weeks into the future, and the possibility of getting the rapid tests and being able to do the tests in their own labs, which will shorten that turnaround time considerably.
The next question is from the Delaware Public Media. How many National Guard members are currently deployed in Delaware? What role are they playing in the response, and are there plans to deploy more Guard members and expand the Guard's role?
So the Guard currently has about, I believe, 11 as of today. There'll be another 18 that come up to state active duty status Monday, and more expected quickly after that. So to date, they've been working very closely with our surge task force to identify locations and the gaps that how we'll assist the hospitals when the surge comes. They've also been assisting the state lab in some testing capabilities with their analytical units. So I think we will see them also be used from some social services types needs, whether it's transportation of patients to the surge sites, whether it's food and medicine delivery to the vulnerable populations. We know this is going to be a bigger strain on our state. So General Barry and his staff has been in touch with us on a daily basis, and they're ready to take on any assignment we have. So we did put in a 32F request as well with our major declaration to allow us to activate more guards at 100% reimbursement to the state, but that's not going to slow us down into utilizing them when needed.
I'm asking this on behalf of our NBC station downstate. They want to know more, and this might be for Dr. Rattay. What about groups like AA and drug addiction groups that can't meet physically now? Has there been any talk of, or is there already a plan in place that maybe we're not aware of about that? And also, are there emergency hospitals being set up or locations picked in all of the state, including Sussex County, where they have an older population in some spots?
Yes, so our sister agency, the Division of Substance Abuse and Mental Health, has been doing a lot of great work to think about how best to support individuals with a substance use disorder or mental health issues, and making sure that they are able to continue to receive services. For example, telemedicine or telecounseling has become very prevalent now, and hopefully, people are becoming more used to this as a way to receive services. AA and groups like that are creatively thinking about how can they best safely continue to support one another, whether it's using technology or, making sure that they're spreading themselves in small groups more than, 6 feet away from one another. But people are looking at creative approaches. In regards to alternate sites, I don't know if the Governor wants to start us off with that.
Yeah, no, just that's something that we've been talking about and planning for since the very beginning, because ultimately that's the greatest risk, particularly to the most vulnerable populations. And AJ, I'm sure, has a report on that. He mentioned it earlier in the press conference, really making good progress, I think, all across the state.
So for the northern part of the state, St. Francis, Christiana Care, and Nemours have really come together to identify a site out at Nemours, so a children's hospital that's going to prepare to use part of their gym and other areas to stand up as needed to decompress St. Francis, Christiana, and other hospitals. Down south, we have several options. We'll be working through the weekend to kind of solidify what we want to do. We have the possibility of maybe utilizing the old Milford Hospital. The concerns with that is the farther you get away from the brick and mortar hospitals, the fewer services you have, pharmacies, x-rays, stuff, other equipment like that. So we just, over the last few days are working with BB, Bay Health, and Nanticoke to really identify what can they do on their site with state support. So whether that means mobile tents, whether that means cots in, everything from clearing out, conference rooms and putting beds in them. So the healthcare community, like we said, that they, if we build it, doesn't necessarily they come, we have to get the staff there. Staff is a limiting capacity, so the closer we could, however we could assist them on their campus will definitely help them increase their numbers while having that manageable span and control type of overview, and the services that are needed, everything from the food to prescriptions, x-rays, oxygen. So that's kind of our vision right now. It's been a little change of battle rhythm over the last 48 hours, but we're confident that we're going to have something here by the end of the weekend to march forward to.
And to AJ's last point there, we learned just this week that each of those facilities have space that's not being utilized right now, but could be converted into an alternative care site. And as AJ pointed out, it's better to do it there where you're close to these other services that otherwise you'd have to stand up if you took it to a facility remote from BB or Nanticoke or Bay Health. So that's been a bit of a turn over this past week. Our working group has really done a good job both tracking the availability of beds and ICU units and ventilators, as well as thinking about alternatives to, when AJ says decompress, that means move people out of the hospitals who don't need COVID-19 treatment or other maybe more serious care, but can be held at a similar kind of facility so that we can treat those who need COVID-19 emergency care. Other questions?
Hannah from WMDT asked, what is Delaware doing to help the homeless population get screened for and avoid contracting COVID-19?
So I'll turn it over to one of my colleagues, but I've asked the Lieutenant Governor to work together with a group of folks that have been working on outreach to the homeless community all across their state. We have a periodic call with the mayors and county officials across the state, and it was brought to my attention by the Mayor West in Georgetown, Mayor Gumshaw in Seaford, that they had issues with respect to homeless populations in their towns, as well as the issues that we have here in Newcastle County. And so we've got a team working through the Department of Health and Social Services, the Lieutenant Governor, and one of the emergency room physicians, Dr. Gibney, who's been doing a lot of outreach through the Behavioral Health Consortium and outreach around opioid addiction and services that have been doing quite a bit of testing of homeless populations. Dr. Rattay, any more about that?
Not a lot to add. It's an amazing group of people with the Lieutenant Governor and Dr. Gibney, with the support of St. Francis and former Secretary Rita Landgraf, have really come together and brought other healthcare providers to go into the community and and engage with either those who work with homeless individuals or the individuals themselves to ensure that assessment for COVID-19 is taking place, and that includes a process for testing, and a number of folks have been tested. Additionally, making sure that, if there is a concern that somebody might have an infection, to make sure that they have a safe place to be in isolation.
Time for 2 more questions.
Please.
In terms of some of the other neighboring states, we saw in Pennsylvania that Governor Wolf came back and amended his essential business list to remove construction sites and some industries pertaining to that. I'm wondering, you've made several revisions in terms of what essential businesses are the last couple of weeks. I'm wondering if you have any more in mind, if you feel fairly comfortable with where we are in terms of workplaces abiding by the CDC guidelines, or anything along those lines.
Yeah, my biggest concern at this juncture, based on what we're seeing out there in public, is people just not following the rules. Essential businesses are businesses that are open. You mentioned construction. I drive by construction sites all the time. I was by one here in the city of Wilmington just the other day, and I saw a gaggle of workers working on a wall where they were clearly not 6 feet apart, and we're in constant communication with the Contractors Association and with those business owners that if they don't follow the rules, we're going to have to shut them down. So I think our focus is more not so much on adding or subtracting from that list, but really on enforcing the social distancing rules in particular on the job sites. And the biggest concern in some cases isn't just the job sites. It's the coffee break, during the job. It's the coming and going. We've made it clear you can't have 5 people, in a vehicle or in a truck out to the job site. You need to be going, 1 person per vehicle and the like. And so it's a lot of changes to the way they're normally doing business. But, we've got to prove that we're really serious about it, that people's lives are at stake, including the people who are not observing the safe social distancing, and that we're going to need to look at making more serious enforcements if that kind of thing continues. We have gotten some pretty good compliance again, so it's not all bad news. I tend to focus on what I've seen and what I hear from people who complain to us about people not following the rules. I also did a little tour myself the other day here in northern Newcastle County and saw a lot of people just following the rules and staying safe.
Last question comes from Delaware Public Media. Governor Carney, are there any other measures that you intend to take to modify your state of emergency declaration? Are there any more measures we can take, and what might prompt a full lockdown within the state?
Well, we've taken this, as the slide earlier in the presentation indicate, almost as a fluid situation, reacting on a day-to-day basis to what we see. The things that's going to drive our decision-making is the graph that we keep showing you, with the expectation that there's going to be a spike that looks something like that. The top of that curve is about 2,000 plus positive cases here in our state. And the bottom, the hospitalization curve, the one that we really focus on, is above 500. And so we don't want to get to the point where we're in a position of making a decision about who gets in a hospital or not, who gets a ventilator or not. We want to make sure that we have that hospital capacity when we need it, that we have those ventilators when we need it, when we have the staff to monitor those ventilators when it's needed to save somebody's life. And so we're going to focus on enforcement and pushing the restrictions that are in place. If at some point the data and the situation suggests that we do something more than that, a complete lockdown of some sort, I'm not sure exactly what that might entail, but if that's necessary, we'll take whatever actions necessary to protect the health and welfare of Delawareans and our most vulnerable citizens. So with that, we've tried to answer all the questions that you have, the media has in this press briefing. I want to close again by thanking all the people I thanked at the top, in particular Dr. Rattay, and her incredible team at the Division of Public Health, Director Schall and his amazing group at DEMA, our hospital partners. I can't say enough about how great they've been. They run the test sites. They provide and order so much of the necessary equipment, whether it's testing, whether it's protective equipment, all the kinds of things that are necessary, and are just doing a tremendous job of really leaned into it. They obviously have their own obligations as independent institutions, but they've really pulled together in a very collaborative way with the rest of our state. Law enforcement officers, first responders, all the public employees that are keeping state government open and the other governments in our state, our partners in the cities and towns, the mayors have been fantastic, and I want to thank all of them. And lastly, I just want to implore on all Delawareans that we're going to get through this if we all stick together. Everybody has an important role to push down, to limit the spread of this virus across our state. If everybody follows the rules, keep your appropriate distance, avoid big gatherings, particularly when you think you've got a special occasion or something that you need to celebrate, think twice. Your actions affect your neighbors, and your neighbors' actions affect you. We're going to get through this, and we're going to get through this by working together. So thank you very much, and have a good weekend.